4:30, so we'll start on time so we can end on time. So welcome, my name is Kat Dimonjoy. I'm the marketing manager for Duke Integrative Medicine. Welcome to our very first virtual information session for the Duke Integrative Primary Care program. So we're super excited to have you here. The entire team is here. So in the essence of time, we'll get started. So I'm going to share my screen. Just also, we're recording the session. But we're only recording the speaker view. So we'll protect everybody's privacy. So I'm going to share my screen and get started. Okay, so welcome again. The agenda for tonight is just very simple. So we have our team here. We want you to hear from our physicians, Dr. Deborah Ballard and Dr. Susan Blackford. They're going to share with you a little bit more about themselves, their background, what sparked their interest in integrative medicine, how they work with patients. So you will hear from them directly. They're also going to go over what Duke Integrative Primary Care is, what integrative medicine is, and how the Duke Integrative Primary Care experience is different from other primary care experiences. They'll also go over a little bit of the approach to care and what to expect when you are working with them and how to build that provider-patient relationship. And then after that, we'll switch gears a little bit. We have Kathy Barati. She's our program specialist, and she is going to go over the more logistical aspects of the program. She is many times the very first point of contact for people. She helps with people with the application process, with helping them better understand the benefits of the program, as well as onboarding them as they become members. So Kathy is very passionate about the work she does, and she's also very knowledgeable. And then we'll come back to Q&As. So we ask you, if you have any questions, to please type into the chat box your questions. We do ask you to, if you have any questions around the program, logistical questions, or anything that it's more around the model of care, that you type in those questions. If we ask people usually to refrain from asking questions that are about individual chronic conditions or any kind of personal medical information, mainly because this is a public forum and we want to respect everybody's privacy. But if you have any questions around the program, something is not clear, then we'll have some time at the end to do that. So without further ado, let me introduce you to Dr. Susan Blackford.
Hi, I'm Susan Blackford, and I've been a physician here at Duke Integrative Medicine for the past 8 years. I started off, went to actually medical school at Duke, and then went and did my residency up in UVA, spent some time in Green Bay, Wisconsin, before coming back to the area in 2002. Worked at Duke Primary Care at the Duke Durham Medical Center location until 2012, when I moved over to Duke Integrative Medicine. And my interest in integrative medicine really came about a variety of reasons. I've always been really interested more in minimizing medications and looking at lifestyle and figuring out ways that I could help empower my patients to take better or take more control over their health. As you may well know, it's a challenge being a primary care physician in this environment, and Duke is no exception. And so when I was doing my busy primary care practice, I got pretty burned out. And part of it was that I was wanting to listen to my patients and wasn't, able to take the time that I really wanted to have. So I ended up really serendipitously hearing about a fellowship program through Dr. Andrew Weil in Arizona, and did that in 2008 and 2009 and 2010. And then that was right about the time that this place was looking at opening a primary care practice in integrative primary care. So I lucked out and was able to help start the program of integrative medicine primary care here, and have been loving it ever since. So that's a little bit about me, and I'll pass it on to Deborah.
So I'm Dr. Deborah Ann Ballard, and I have been with Duke Integrative Medicine since January. So it's been an interesting experience coming in the midst of COVID, but I will say I've been extremely pleased and impressed with how everything has been handled here at Duke in regards to the pandemic and in keeping our patients safe, our staff safe, and being very conscientious about how I've been so impressed with how nimble they've been and how responsive to the changing demands that have been made as a result of this pandemic. But I'm internal medicine. I have worked in a variety of different settings over my career, primary care. I spent 6 years working exclusively in endocrinology. I have done clinical research. Um, and was really during my years of doing clinical research and working in endocrinology when I started to really understand that we needed to go beyond pharmaceuticals and really look at lifestyle factors, the whole person, what was happening in their life, and not just trying to rely on medications or surgeries to address chronic health conditions. So at that point, I started working in a cancer prevention program in Louisville, Kentucky. And during that time, became introduced to a group of nurses who were working in integrative medicine. And that started my journey in terms of study with integrative medicine. During that time that I worked in cancer prevention, I became board certified in integrative medicine and also obtained my master's of public health. And so there's a lot of synergy between public health practice and integrative medicine because they're both about looking at the root causes of disease. What is happening in a person's life or what has happened in their life that has caused them to develop health problems? And how can we help them address those things so that they can gain good health? Also, obviously, working in prevention, cancer prevention, I was very interested in things like nutrition, diet, how do we work with stress reduction. And then after I worked in the cancer prevention program, I was the medical director for the Ornish program, which was one of the very first integrative medicine programs developed that actually was shown to be able to reverse heart disease through lifestyle change. And we used a combination of nutrition, exercise, stress reduction, and peer support. So my years in that program just really solidified my belief that we could really make remarkable changes in people's lives through addressing an integrative, holistic approach to health. And so I have been extremely happy to be here. It's been an unusual year, but it has really been very enjoyable to be able to work in this wonderful team approach practice.
So, oops.
So,
So first of all, what is integrative medicine? And it's helpful to start here because a lot of people use the term integrative or integrated, and there's a lot of confusion about those two terms. So it's helpful to sort of sort out what we mean by integrative medicine. The classic definition is the combination of conventional medicine with other modalities that can augment what we do in terms of conventional care. So it can complement what we do in conventional care, and other modalities that have some data behind them, that have some evidence base behind them. So it's really this combination that gives us a bigger toolbox to work with. And so instead of just having the conventional tools, we have all these different modalities that we can choose from in the complementary or integrative world. It's also looking at health as a fuller spectrum, or looking at the influences on health in a broader way. So we're not just looking at your physical health, we're looking at the emotional components, the mental component, the social component, which has been really impacted quite a bit by the pandemic. We know that social interactions make a huge difference on health. The spiritual component, the environmental component. So it's getting a broader view, more inclusive view of what medicine is. It's also patient-centered. And you hear that term kind of bandied about a lot, but I think with the increased time that we get to spend with patients, it really truly is patient-centered. And we really want to motivate people to be the drivers of their own care. So we want to support your health goals. We want to figure out what your goals are, not what our goals are, not what the guidelines say, but what are your goals? And it's also stressing the importance, the therapeutic importance between the patient and the physician. I mean, that's a therapeutic relationship. It's not just a one-way street. It's a back and forth. And actually, if you can develop a good, close relationship with your physician, then you can feel more free to share information that you might not otherwise share. You might think, well, I don't think this has anything to do with it, but it might. And so it's kind of like when you go into medicine, it's almost like you become a sleuth, sort of a Sherlock Holmes. And if you don't have all the clues, you're not going to get to the answer. And so having a trusted relationship allows us to get all the clues that we need to really help you figure out what's going on. And then it's not just about health as the absence of disease. It's health as really taking you at whatever point you're at and optimizing things, making it better. You can actually be a cancer patient and very advanced, but have wellness. So it's looking at how your mind, body, and spirit are doing all together, and optimizing the quality of your life. And also its emphasis on health promotion, prevention. So again, less of a focus on the disease, although we certainly see a lot of people with disease, but it's really looking at what is going well, what is your health, where can we get you even better. We have a wide range of patients, and we have some patients that are really pretty well, but they want to be even better. And we have patients that are very, very sick, and we take you wherever you are and try to move you in a positive direction. Next slide.
So when we talk about our primary care practice, we are a full service primary care practice. And we work in conjunction with the greater Duke University Health System. We, as your primary care physicians, our job is to do a complete assessment of what are your needs to help you reach your health goals, and then help you connect to all of the different services that you may need to achieve that. If that means coordination with specialists within the greater Duke system, that's what we're going to do. We usually work with one or more members of our integrative medicine team, which includes experts in nutrition, acupuncture, massage, behavioral health. We also have a close relationship with our fitness center and working to help people find the right type of movement, physical activity to support their health. Physical therapy is something that we refer to a lot because it often really is needed to help people heal from problems, but also to prevent problems. So our visits with our physicians are billable to insurance just as they would be with any other primary care doctor. Um, and when we refer to our other integrative team members, that is more individualized in terms of what insurance will cover and what it won't. But Kathy will address that more. One very important part of it is we are experts in the evidence-based complementary treatments. So as Susan alluded to, integrative medicine can mean a lot of things to a lot of people. And if you've had experience with integrative medicine practitioners, sometimes outside of academic centers, some of the things that they do may be based on more anecdotal treatments, but we really do look at the evidence. But the good news is this: there's a lot of very compelling evidence for the complementary therapies. There's massive evidence to support optimizing your nutrition, movement, stress reduction, pain management through non-pharmaceutical, non-surgical approaches. So it's our job to know the science, what has been proven to work, and to try to help our patients access the modalities that are going to resonate most closely with them, what they prefer, and what we have the highest expectation is going to work. Also, one of the differences in integrative medicine, as opposed sometimes to other forms of medicine, is we are very much about discussing the benefits and the risk, or the pros and the cons of any kind of treatment. So there are times when the benefits of traditional medicine are very clear. And when that is the case, we're going to let you know that and help you, understand the science. But a lot of the things that we do in integrative medicine have very low risk of causing any harm and a reasonably high expectation that they're going to help. So some of the things that we do, there may not be the traditional randomized, double-blind, placebo-controlled trial to support it, but there is a reasonable expectation that it's going to help, with a low expectation that it's going to cause any harm. A few other things: either myself or Dr. Blackford are on call 24/7, so we're available for you. When we're in clinic, we keep slots open for same-day appointments, so typically our patients do not have any difficulty getting their needs met in a very timely fashion. We do have longer appointment times than traditional primary care practices because, again, we're trying to really get at the root cause and really work with you very individually. So you'll have more time to spend with us to talk through things and really go into the nuances of some aspects of care that you may not be able to discuss in a less individualized practice. So I think that, for someone who really wants to focus on their health, who really wants to have that level of intention of wellness, health, and maintaining, we provide the kind of high contact, time intensive therapy that allows for that.
Next slide. So this is our sort of our symbolic approach. We call it the Wheel of Health, and sort of symbolizes the way we approach each and every patient. At the center is you. That's kind of obvious because you are the most important. You're the reason why we're here. Around it is mindful awareness, and what that really speaks to is it's important. always think of it as, if you're going on a trip, you kind of want to know what's in your closet, you know, before you go, so you can pick and choose what you're going to go. You got to know where you are in this moment right now before you start the journey. You got to know, you know, where you are emotionally, where you are physically, and get to some comfort about that, and really approach it from a very non-judgmental way. This is where I am. That doesn't mean that's where I am, you know, 2 years from now, but this is where I am now. And so then you can better see where you might want to go from there. In the green is all the areas that are under your control, in terms of areas you could explore, areas that you might want to improve upon or change in some way. And there's some obvious things like nutrition. I mean, that's always a good one to go for. Most of us could use some tweaks and improvements there. And then movement and exercise, that's always another obvious area. But rest is one we don't always think about. And that I would say is just as important as movement. If you're not getting rest and you're not allowing your body to recuperate from any movement, you're not going to be at your optimum. And you're not going to function mentally as well if you're not getting your rest. So that's something that we definitely like to stress, is to make sure that you're getting good rest. And we say rest because it's not always going to be complete sleep. And rest is very beneficial, even if you're not able to have a complete, wonderful 8 hours of sleep at night. Other things are things like your physical environment is also very important, and you have some control over that. And that can be, you can think about that as being, are there things like mold issues or toxins or things like that? That's one aspect. But another aspect of it is, how do you feel when you walk in your room or into your home? Is it a calm, relaxing place, or is there like clutter all over the place, or does it feel like things are just overwhelmed there? And so paying attention to that is also important for your physical, emotional, and mental health. Relationships and communication. A lot of studies show the importance of good, healthy relationships, and the detrimental effects of not such healthy relationships. So that's another area for exploration. Spirituality, and by that we mean makes you feel connected to the greater out there, whether that's in the form of religion or other approaches, but whatever gives you meaning and purpose is really the most important piece of that. The professional and personal and professional development, that can be your job, or it can be volunteer, or it can be, again, whatever means of personal growth. Is that need being met? Is your job meeting your needs in that way as well? And then mind-body connection is how aware are you of your body is mainly what that refers to, or even how aware are you of what's going on in your mind. A lot of us are during this time of COVID are so into our computers that you just lose total track. It's like an out-of-body experience. You lose track of what's going on in your body until you go to get up, and you're just incredibly sore all over because none of your joints have moved for the past 6 hours. So it's cultivating that awareness that our mind and body are one, and we want to be aware of both of them, and really make sure that we're treating both of those. And then the blue is sort of how we can support you. So the middle is kind of you and your journey, and the blue is, kind of think of that as us, with our arms giving you a big hug, and how can we help you with that? So again, we use both conventional and complementary approaches, and with a goal of really not only doing intervention, but a lot of prevention. So how can we make your trajectory really positive in terms of your health? Next slide.
Yes, and we really do work as a wonderful team here, and we are so fortunate to have other team members who are just at the top of their field. So we have nutritionists who specialize in integrative medicine and address those issues that we look at a lot, like the microbiome health, for example, or specific micronutrient deficiencies that may be playing a role in health problems. We have massage therapy. At, our massage therapist is incredibly well trained in therapeutic massage and application to patients who are very ill. She is outstanding. Behavioral health, we have a wonderful behavioral health psychologist who helps patients work through the issues that have to do more with emotional problems, relationship, past trauma. And then acupuncture. Acupuncture is a wonderful modality. Of course, it comes out of traditional Chinese medicine and not only involves the use of the needles therapeutically, but also talking about bringing balance back into the body and how to use certain medications or herbal preparations from traditional Chinese medicine that can also be helpful. And you know, we meet as a team. We have case conference. We discuss cases that where we really need to put all of our heads together and come up with a very cohesive plan. So there's communication amongst all of our team, and having several smart, caring people work through problems often leads to good solutions for patients. So it's a wonderful supportive approach. And then of course, we also have our relationship with the fitness center where that entity provides fitness trainers, exercise, and can help us fill in the gaps in movement, physical activity. So it's probably something that you may not have been used to in a more traditional practice, but for folks who really want to work through chronic health conditions or really maximize and optimize their health, it takes a team approach, and that's what we provide. Oh, and in addition to massage and acupuncture and nutrition, also we do provide yoga therapy. Our yoga therapist will work with folks either one-on-one or is providing, as I understand, some virtual sessions as well where people can join in. And then available through our website are mindfulness training sessions. Mindfulness is a wonderful tool to help you come into a peace with your surroundings. And as Susan was saying, where you are right in the moment, where you are now. So these are additional modalities that also are provided through our center.
So what can you expect? I'll just add to that. It's in terms of the teamwork. That is in terms of working here, that is one of the real wonderful perks of just being able to go down the hall and ask Janet, our acupuncturist, hey, you know, what do you think would help this person? It just is, it makes it so much more pleasant because first of all, you don't feel like you're practicing alone. And you know, I can go down and bounce ideas off Deborah and she can do the same to me. And so it's just a wonderful collaborative environment that's really a joy to work in. So what to expect in working together? Again, this is all about partnership. This is all about, you know, figuring out what your goal is and reaching your goal. And yes, we're going to talk to you about, you know, what the recommendations are. And we want to keep on track with that. But but it does really boil down to what's important to you, and where do you want to be in life and in your health. We're again going to do a whole person approach, meaning that we're going to look you from head to toe and stems to stern, and also looking at you from an emotional, mental, physical, spiritual. We're looking at the whole ball of wax, and nothing's off the table. And we're again going to do a little deeper dive, and the extra time allows us to do that. I mean, this is, we have excellent primary care providers in the Duke system. Many of them are good friends of mine. They do a fabulous job. And I think they would love to practice the way we do. It's just that the system only allows them a certain amount of time with each patient, and often they're lucky if they get 10 minutes. And that's just really, it's really challenging to do any kind of deeper work in that small period of time. So we have the privilege of getting an hour intake at the beginning and then half-hour follow-ups. We can communicate with you on a regular basis through my charts, which is a great, if you're not familiar with the Duke Epic or any of the Epic systems, is a great way to communicate back and forth, because it gets you right in, for us, it gets you right in the chart. And so we can look things up really easily, and it also tracks it. So if we have a communication and do a medication change, and I kind of forget which medication we changed, I can go back in the notes and say, okay, that's what it was. So it really helps us track, how we've progressed in our conversations about changes. And so again, it's really the whole goal is to work with you and to empower you to make the changes that you want to see. Yeah, and that's about it. Next slide.
Okay, everybody. So now let me introduce you to Kathy Berardi. She is a primary care program specialist, and as I mentioned, she is very passionate and knowledgeable about the program. She dedicates, all her time to working with members and all of those of you who are interested in becoming members on better understanding the program when we are in non-COVID times. She also gives tours of our spaces, and she's just overall just a great person to work with. So she is going to do a quick overview of kind of the more logistical components of the Duke Integrated Primary Care program. So I'll give it to Kathy.
Okay, well, thanks for joining us tonight. I appreciate your interest in our membership-based primary care. I want you to think of me as a resource. I'm here, I'm a tool to help you, because I know that everything in, healthcare has changed so much, and it's hard to make a determination of what's a right fit for you, and there really is no one size fits all. So feel free, reach out to me. I can help you in a couple of different ways. So when it comes to insurance, now we are part of the Duke Health System and therefore accept all the same insurances that the health system does. If you want to quickly check to see if your insurance company is in network with Duke, you can simply Google insurances accepted at Duke, and that will bring up a big list of all the companies. But perhaps you want to know about your particular plan. How does that align with the different services? The different services we offer is the primary care specialist, health psychology, nutrition, health coaching, massage, acupuncture. So if you want to know how your particular insurance is going to align, reach out to me. And I know a lot of people are going to have a lot of additional questions, things that you'll think of at a different time. So if you need any kind of clarification or you have more questions, I get it. And please feel free to reach out to me. If you're interested in becoming a member and want to explore what are the next steps, again, reach out to me. Now, Kat will put up my email address at the end of the presentation. So that is the best method. This way you could pose your questions. I could get back to you if you need the necessary forms, however I could help. that's the best method for us to get in touch. You know, I feel really fortunate to have this role. First of all, I enjoy helping people, but I also get to witness the care that goes on here at Duke Integrative Medicine. And it really, you know, to get to know a patient when they first come in, and I'm not a medical person, I'm your average Joe Blow. I don't know anything about medicine except what I've witnessed here. But I meet people when they're first coming on board, and many times they'll stop in, whether it be 3 months, 6 months, a year, or when they just see me, to stop in to, you know, touch base with me. And it's wonderful. It's wonderful to hear their experience and how much it's meant to them. So, you know, I think you could already tell our doctors are compassionate. They're very caring and understanding, and they're very easy to talk with. The additional time for the membership, that's going to give you the opportunity to build that relationship with the doctor. And that's the best way to work towards your better health. There is no other primary care anywhere that's membership based, or even regular primary care, that has the benefits that we offer. So our membership also includes, Kat, next slide, the fitness center. You know, both the doctors had mentioned the fitness center. It's part of Duke Health and Wellbeing. It is included, the membership to there is included with the primary care membership at no additional cost. Now, this is more than just a gym. It is a medical facility. Everybody there, just as our massage therapist, acupuncturist, just as our clinical staff is highly trained, so are their staff. They have exercise physiologists to help you with personal training. They have, you don't see it in this particular picture, but there's an indoor heated saltwater pool. And as you could tell, there's much that's only half of the space. There's a lot more equipment. They offer cardio classes, strength training classes, mind-body classes, and then there's a full schedule for the pool. They have the water classes and open lanes. Okay, next slide. Next one, Kat. There we go. We mentioned about our other clinical services, therapeutic services, what we call it. As a primary care member, you would receive 10% discount on the various services: acupuncture, massage, therapy, and yoga therapy, and health coaching. And that's individual health coaching. Now, that other picture is of our cafe. Right now, due to COVID, it is closed. Things are going to turn around. We'll reopen. And then you'll be able to enjoy the space. It's beautiful, lovely food, and you'll get a 10% discount if you're a primary care member. Next. Okay, we also teach here at Duke Integrative Medicine. There's the clinic and there's the educational aspect. We offer classes on mindfulness, writing to heal. That is a very, journaling and learning how to do that is a very positive tool to learn. And you can see yoga, many, many programs. If you're a primary care member, you will receive a 10% discount on our programs. Now, right now the classes are virtual, and we offer professional and non-professional classes. So you might want to check out the offerings on our website. Next. Next one, Kat. Okay. Now our facility. I don't know if any of you have been here, but our facility is absolutely beautiful. It's award-winning. It's serene. It has a spirit and energy all its own. Now the primary care members get full access to, there's different areas that we have. The spa area, if you could go back. Yeah, thank you. In the spa area, there's a whirlpool, sauna, steam room. There's a locker room. We provide towels. The showers are private, and we have them stocked with Burt's Bees products. So you don't have to bring a lot of stuff. It's all, you know, just bring you and lock up your belongings and enjoy the space. Outside of the cafe, there's beautiful gardens and a labyrinth. That's a form of meditation, walking meditation. I find it to be, of all the meditations, the one that causes me to do the most focusing on what I'm supposed to be doing rather than my mind ruminating and going elsewhere. And plus you're outside with nature. It's a beautiful location. We have meditation rooms indoors and out. Right now, due to COVID, the facilities are closed. Just the clinic at this point is open for the safety of our patients. Next one. We also do research here. So our research team, they're striving to determine the health outcomes of various integrative approaches. You know, Dr. Ballard had referenced that, you know, studies might not be a double-blind study, but the best way to determine outcomes of integrative approaches is actually to do research and to follow up on people. So anyway, that's what our research does here. Next. Okay, so we have dedicated team. The doctors are very dedicated and everybody else, but you also have a guest service team and a nursing team that members will work with. The guest services team, they're warm, they're caring, and they're the first people who will greet you when you come in our doors. The nursing team, you cannot meet a nicer group of nurses. It's just not possible. They're really caring, easy to talk with, and we have 4 of them. We have a very high doctor to nurse ratio for such a small clinic. And everybody here, wonderful team. Next. Okay, so the cost and the insurance. The monthly fee for all of this is $150 a month. Now, most people, we can get you set up. We have an online system, so you could just have a recurring monthly charge rather than having to pay a full yearly membership fee, which is a lot of other concierge or membership-based programs. You have to pay a full amount during the year. Now, because again, we're part of the health system, so everything's billed to insurance if insurance will cover it. Now, unfortunately, people ask about their health savings accounts or financial savings accounts, whether the membership fee can be used, can be paid for through that. And unfortunately, the answer is no. The IRS does not allow it, but they do allow reimbursement for any of the services. So in other words, you've seen the primary care doctor, you can get reimbursed for that, for massage, acupuncture, just not the membership fee. Now, we do also have a discount for Duke employees. We truly value our employees, and you would just need to get in touch with me and I'll let you know about the discounts we offer you. And again, please reach out to me. If you have any questions about your specific insurance, I'm here to help and I'll get you that information you need. Just reach out.